welcome to this postnatal yoga class for moms that start reintroducing yoga in their practice. This specific practice is going to be a short one, as you know, especially at the beginning. I'm thinking here 10 weeks to 20 weeks postpartum. You don't have much time. And obviously your body is just restarting to gain strength. Don't take the weeks as a universal type of sort of limit. It's very, very specific to yourself. So it might be that you're going to practice this later on when you are 6 months, when you are 3 months postpartum, when you're 9 months postpartum. It doesn't, really matter, because your journey is going to be yours, and it's going to be, specific to each individual. This class focus on providing some relief and strength for the lower back pain and for mild prolapse as well. So obviously, we might not be able to resolve these problems, but it's a sort of like a working together type of approach. But let's start. We start standing. So make sure your feet are hip width distance apart, and make sure both feet are grounded. Lift and lower the toes a couple of times to make sure your toes are spread and they are feeling the floor. And just feel for the four corners of your feet, and ground around those places. So focus on those 4 places of the feet, which we hardly ever do. And from here, you're standing in mountain pose. So we make the mountain start from the ground. And from here, we come up to our knees, invite a soft bend if this is needed. Straighten your back. As imagine a thread lifting your head up to the sky. And then the palms are facing the front, they're facing the screen, they're facing me. And the shoulder blades slowly drop down the back, creating more distance in between the ears and the shoulders. When you create this mountain, then we're going to focus on your breath. Simply noticing your breathing in and out. You can focus at your breath in the chest, so the movement of the chest. Breathing in, the chest expands. Breathing out, the chest drops down, relaxes. You can focus on your belly. Breathing in, the belly expands. Breathing out, gentle contraction, relaxation at the same time. And also you can focus on the breath at the level of your throat. Noticing the difference in temperature. Breath coming in, cold. Breath leaving the body, which is. Or you can use the sensations at your nostrils. Again, changes in temperature of the breath in the nostrils. Close your eyes if that helps going within. Ready. Invite some movement in the body. Wherever feels good, perhaps shake your legs, open your eyes. And we're going to practice this again, this time with a Pilates ball, if you have one. If you don't, I highly recommend buying this. You can find these on Amazon or like in yoga websites as well. And we're going to use the ball standing by placing it in between our thighs. The ball, as you can see, is not fully inflated. It's sort of like 3/4 inflated. We place it in between our thighs, and we just now, again, go back into mountain pose and just invite a gentle squeeze in between the thighs. You might practice this during pregnancy. We continue to practice the strengthening of the inner thighs during the postpartum period and forever. really. So see if the posture changes, if it's easier to find an upright position in which your head aligns and it's not, you're not leaning forward or leaning backward or you are crunching. And thanks to, this engagement of the thighs, if this builds some strength in your overall posture, not just, in the thighs. As you see here, things are a bit different because we are engaging some muscles and not fully relaxed. When you're ready again, if your eyes are closed, just blink your eyes open and let go of the ball for now. And we're gonna practice again with the ball, this time at the wall. I have this wall here. Hopefully you have like a better one than mine. So we're gonna use the ball and place it at the level of the lower back. First for some massage, so you can use the ball for very, very gentle massage. If your lower back is tender, you don't want to use like a hard ball, like a tennis ball or a spiky ball you can see on the side there. Obviously, feel free if you feel like you need a little bit more of pressure to use those, but if your lower back is tender, painful, just this could be a very nice way to start integrating movement. As you can see, I'm doing some undulations, some gentle bends of my knees, or we can take this further down by, doing like a squat on the wall. Again, we are creating new muscles, reconnecting with the muscles of thighs and our buttocks as well. So when we come up, invite a gentle contraction on the thighs, and then, we go down. Let's take the breath with us. Breathing out, we go down. Breathing in, we can come up. And also you can take the pelvic floor in this exercise as well. So each time you come up, you create a gentle contraction on your pelvic floor and then a release when you come down. I'm sorry, and keep it contracted when you come down and then release when you come up. Apologies. So breathe out, contract, breathe in, relax. Breathe out, contract the pelvic floor, breathe in, relax. Obviously, if there's mild prolapse, you might want to do this with the legs, closer to each other to avoid, making the prolapse worse. But this is a very nice one, so you can massage your lower back as well. If you can keep your legs wide that way. We're going to move on the floor for some like awakening of the spine. Keep the ball. We're going to use it again. So we just lower down on the floor and find our hands and knees position. As usual, I want to show you on this side. As usual, just make sure you are on a mat at all times. We still have relaxing in our body during the postpartum period. So things like wrist, hopefully, if you had any wrist pain, it's all gone now. Just want to make sure we don't re-trigger pain or create pain. So anytime you can, rest on your fists or use the blocks as well to support your wrists. So you can use the blocks to support your wrists like this as well, or you can do the exercises on your forearms, just in case if they become painful. And don't forget, to introduce very gentle wrist stretches, and we can do some in a minute as well. So from all fours, we're gonna do some cat-cow. This time, we're gonna take it to a fuller expression. So gently also the cow position when not just the cat, when we breathe out. So breathing in, we round our belly and back and upper back. Breathing out, we flex. Breathing in, we round. Breathing out, we flex. Make sure you start this movement from the belly button. So belly button reaches up to the sky and belly button reaches down to the floor. So this time the movement is triggered by that, and we just travel up. If it's possible, we take the neck in the exercise, but you don't have to. You can keep your neck neutral if there is any tenderness or any issues with your neck as well. We do a few of those before moving our hands to the right. We practice again a little bit of a difference here. Hands on the shoulders, or a little bit in front of the shoulders. And then we move to the left. Back to center, we practice thread the needle. Again, to improve upper back motility. Breathing in, the right hand comes up to the sky. Breathing out, and thread it in between the left hand and left knee. Just a few breaths here. From here, we can practice extending the left leg back, if possible, and keeping the foot on the floor, and then back in. Or we can stay in this pose and feel the stretch on the upper back, the scapulae separating from each other. When you're ready, come out of the pose. We just take a refocusing breath, making sure our hands are well spread on the mat, checking in for any wrist tenderness. If so, we can have a break, do some circular movements, very simple type of stretches on the wrists or figure of eights as well. And we're going back in. This time the left hand comes up and it threads in between the right and the left. The hand gently on the floor. And we practice extending the right leg, but keeping the toes on the floor if we want to add this on. Not necessary. Make sure when you move your leg back, your pelvis stays square, so there's no tilting. Just 3 breaths here, focusing the breaths in between the scapula, in between the shoulder blades, feeling the stretch there. Finding stability and groundness in this pose. Breathe it out, come back up onto all fours. Again, we just do a little bit more of mobility of the wrist before practicing bird dog. Bird dog is pretty much present in all my classes postnatally. It's a way to re-engage the abdominals, to start reconnecting, that it doesn't pose a lot of pressure on them. So see how you feel practicing this. First, we practice extending the right leg back and bringing it up to the level of the hips. So no, opening the hips, we keep them square, and the foot doesn't need to come high. So stays at the level of the hips, and then bringing it back down. And ideally, we keep the pelvis stable. So there's no, shifting of the pelvis. Same from the other side, leg comes back. First can go down, and you can give like sorry about the door. You can give like a stretch here and then bring it back up. Again, we just notice what happens to our pelvis. No, shifting shapes. Ideally, otherwise we can stay on the floor for now. And then bring it up at the level of the hips. From here, the leg comes back in, and we practice the same with the arms. The right arm comes up, again at the level of the shoulders, and then comes down. Arm is facing inward. And this side, we're going to practice alternating. So the right leg comes up, and the leg, arm comes up, and then back into center, and then we alternate. Also, we want to make this, sort of active. So we just go a little bit faster, but see, how it feels for you. Ideally, we practice from 6 to 10. But if today's your number is 3 or 4, so you try to make it symmetric, this is where you're at. Just making sure always we use the abdominals to stabilize the hip. So there's a lot of gentle abdominal engagement. If this is too much, you can practice just the legs or just the arms, and imagine the other leg or arm, moving. The imagination might already create some abdominal engagement, very gentle one. Once you're done with your both sides, we're going to rest into child's pose. So the bum reaches the heels. If it doesn't, like in my body, you can use a block and then gently lower down. You can rest your head on the ball, perhaps. If that doesn't reach, we just feel here for the stretch. Just tiptoe our fingers a little bit more away from our core, our center. We reconnect with our breath. Simple breath awareness. The easiest, but also the most difficult at the same time. Just a couple of breaths here before moving into pigeon pose. This pose is particularly useful. You can keep on resting. Absolutely, never move as you need to. This pigeon pose is particularly useful, and it was very useful for me for sciatica pain, but not when the sciatica was acute, when you had actual pain when you were walking, but just in between, the inflammatory phases to create a nice stretch. Obviously, this is a big hip opener, so I'm going to show you on the floor, but you can practice this on, as a seated position, and I'll show you that as well. We're not going to keep the stretch for longer. For long times, again, it's a hip rotation, external hip rotation. You still have relaxing, especially if you're breastfeeding. So the other option is to avoid this completely and maybe gently using either the spiky ball, a tennis ball, or this ball to massage, again, the lower back area on the wall. This, as I did before, you can do the same with the spiky ball and focus this time on the glutes, very gently on the glutes. Your sciatic nerve comes out at the level of the sacrum, so the triangle of the back of of the end of your back. Here on the door, and you can just practice like massaging gently around the area. Don't go exactly on the bone because that's where the nerve comes out, so you don't want to increase tenderness. So that's option one. You can take it again further with a pigeon pose on a chair, a figure four on the chair. You can do figure four on your back as well, because now, you're not pregnant anymore. You can do things, on your back. So these are the three options. So I'm going to show you the pigeon. From pigeon pose, we get into pigeon pose, either from downward facing dog, but you can practice that as well, or we get it from all fours. So from all fours, again, hands under our shoulders, our right knee comes up to meet the right wrist, and then we pivot, we turn. And so the right comes in, we pivot, so the foot now is trying to reach the left leg, and we just lower down. We stay high for this pigeon pose, because obviously if we come down, we increase the stretch. We just practice a couple of breaths here, see how we feel. We might need more support under the hip. Perhaps you can use the ball or some cushions or the blocks as well. Once you're done your couple of breaths, we gently push, we turn the leg, then to the short edge of the mat, and we push again. Another breath to reset, see how we feel before bringing the left knee towards the left wrist. We pivot the leg and sort of imagine and move the left foot towards the right wrist and lower down gently where we feel the stretch. Again, you can use cushions or block to support. We try to avoid, pivoting this way, and keep again your pivoting towards the left this time, and keeping your hips square in this pose. So it doesn't really matter if you don't touch the floor as long as your hips stay square. Notice also on the right side, you have an extension here, a stretch for your hip flexor on the right side. Couple of breaths here, we engage the back foot, we bring the foot in and pivot the left foot into being your shin parallel to the shorter edge of the mat. From here, we'll sit down again into child's pose, and I'll show you the modification quickly. If this is too much, don't feel, upset. You'll have different, as I said at the beginning, you have different levels at different times of your life. So we gently, move onto our backs and gently lower down. Ideally, do it from the side again, and rolling as you would do to, go to bed. And from here, we can bring our both feet on the floor, right right foot comes up to just be in front of the left knee. And we can stay here or take this further by interlacing our fingers behind our thigh. But even if you stay here, inviting this rotation and activation of the glutes might be enough. And obviously we can then lower down, practice on the other side. This is an option as well if pigeon feels too much of external rotation. So please maybe start with this option and then move up to the pigeon as well. You're gonna stay again on supine, so we can lower down with our back on the floor. From here, we're gonna do a twist in between, one side and the other. And this is going to be our final pose before Shavasana, which we can do with legs on the wall as well. And it's going to be a shorter Shavasana because it's a shorter class. So from here, again, moving on to the side, and then we lower down. So our back is on the floor, as in the previous pose. We're going to practice twisting from one side to another. So feet on the floor, and this resting gently on the floor, palms towards the ceiling. We can again use the ball in between our knees or a block. With our out breath, we rotate to the right side. Both knees go on to one side. The head can go to the left if that feels okay. Make sure your left shoulder stays on the floor. So it might be that you need support, not just in between, but also, lying down. If your right knee doesn't reach the floor. When you're ready, use your arm to bring your both hands to bring your knees up. Spend time in the middle, knees come to touch. Feel the difference in the twist from one side to the other. So bringing both knees towards the left. This time, right shoulder stays anchored to the floor. Head can turn towards the right, stay centered. Support can be, provided to the left leg. You use your arms to bring the legs back to the center. Again, knees come to touch. Just a few breaths here before moving into a short Shavasana, which could be resting on the floor. Make sure you are supported, grab a jumper, some socks on, or you can also practice legs on the wall. So this time I'm gonna be legs on the door. it doesn't make any noise. We come closer to a wall. You can pause the video and find a wall. And we just put our, we just go side to the wall. Sorry, I'm showing you in my back. And we just go as close as we can. I would recommend not going very close to start with, and just, see where your flexibility is in your hamstrings and thighs. And then from here we lower down, and while we lower down, we pivot our legs up to the wall. As you can see, still a little bit away from the wall. That's absolutely fine. With time, I'll come closer. So want to leave this area, not close, and quite open for, the lymph to flow back from my legs. From here, as I said, the legs are hip width apart, and I can feel the difference, how I feel when I stretch the legs completely compared to inviting a micro bend. And inviting a micro bend might mean I can come a little bit closer to the wall. If I want to get closer to the wall, I'll just bend my knees, come back down, and then move myself closer to the wall, and then lower down gently, and then come back up. I'm very close, and I have to push myself away. But then again, we practice and see with the level of comfort, the pose might change every day. Here, the arms can come up if that feels restful for you. Come down in a cactus shape. It doesn't feel restful for me, or just open. Again, if you take Shavasana on the bed, on the floor, on the sofa, that's absolutely fine. Whatever feels restful. As usual, first part, we find comfortable position. We can stay in for a couple of minutes or so. If this is not comfortable, please do change it now, and feel free to come out of the pose anytime if it's not comfortable for you. Now we focus at the point of contact of the body with the floor, the wall. Come back to the present moment. Maybe take a bigger breath. Maybe let it sigh out of your mouth quietly, or you can make noises as well. I'm not watching you. Then we go back to where we started, focusing on the breath. Just sort of breath in and out. Feel the difference now compared to when you were standing. Where do you feel the breath moving? Your mind wanders, just bring it back to simple breath awareness. Simple, but not easy. So your mind will definitely wander at some point. Bring it back to the breath, and if it's necessary, you can just name the breath as in when you breathe in, out when you breathe out. Relax your jaw, relax your eyebrows. Leave a couple of minutes without me talking. Okay. Come and join you again at the end. Maybe invite some bigger breaths. Start awakening the body. Please place your feet on the floor. Very slowly, very gently turn to the right side. Rest into fetal position. Gently push yourself up into seated position. Wherever how it feels good for you to be seated, even on the ball, why not? And again, thank you very much for practicing this short, hopefully very powerful postnatal practice. And I hope to see you again.